Tomorrow, Rhode Island will officially know who will be next in line to get their COVID-19 vaccine. This after the rollout has stalled and there aren't enough shots to go around.
So the Rhode Island Department of Health reassuring the public today that progress is being made on the vaccine front. But for now, testing and treatment is available for everyone. 12 News reporter Chelsea Jones live for us in Providence tonight. And Chelsea, you spoke to a member of the Vaccine Advisory Committee, and she says that in her eyes, teachers are a critical population and they in fact should be prioritized.
Right. Dr. Carrie LaPlante says it's an impossible situation because Rhode Island has such a limited supply of the vaccine. But tomorrow at 1 here at the Veterans Memorial Auditorium, we will likely know who will be included next in phase 2. Age, occupation, and geography, the three groups chosen first to get vaccinated in Rhode Island, may now also be accompanied by teachers who have pushed hard for prioritization.
It wasn't that we are not prioritizing teachers and occupation, because that is a critically important group.
Thursday, the State Department of Health making the call on who makes the cut for phase 2.
Absolutely, occupation should be a consideration because our framework is to protect public health, which is decrease death and hospitalizations, and a very close second is to open up the economy, and that's occupation based.
But right now, RIDO is tight-lipped. With such limited supply of the vaccine coming into the state, health officials want it to go to those at highest risk. And Advisory Committee member Dr. Carrie LaPlante says teachers and other frontline workers should be included next.
Those are grocery store workers. Those are bus drivers, custodial workers, teachers.
That's in addition to older adults who have been hit hardest by the coronavirus.
We have to acknowledge that the highest death rate within our population is those over 65. And a good community protects their most vulnerable first.
And if you are sick with COVID, monoclonal antibody treatment is encouraged and testing is always available. Over in the Bay State, those who are 75 years and older were able to sign up for a vaccine, and that started today.
Chelsea, we know that there have been some problems in Massachusetts with folks trying to make appointments today. So what is Governor Charlie Baker saying about that?
He's saying people have to be patient and continue checking that website at 5. Will break down what they're doing to ensure that everyone has access that they need to vaccines. Guys.
Chelsea Jones live in Providence for us today. Thanks so much.